Well, there are a couple of reasons. The type of virus that's dominating this year is what we call an H3N2, the designation of this particular kind of influenza A. It historically is a bad actor. So whenever you have this virus, this type of virus dominating, you generally see a bad season and you generally have more complications, particularly among the vulnerable people in whom complications are more common, such as the elderly, such as individuals with underlying conditions, as well as children from birth to 4 years old. And also, as we know, the vaccine this year, although it's always best to get vaccinated, is not the perfect vaccine. It is not, as we would say, favorably efficacious, in the sense that we only don't know right now what the efficaciousness is going to be, but it likely is not going to be much more than around 30%. I say that with some trepidation because I don't want people not to get vaccinated. Every type of protection against the virus with a vaccine is better than no protection at all. So a combination of a vaccine that doesn't work very well and a really bad virus. Well, the first thing you should do, and again, getting back to vaccination, if you have not been vaccinated, you should get vaccinated. That's for sure. Then if, in fact, you do get infected, if you have what looks like it's going to be a serious infection, don't hesitate to get to a healthcare provider who can get you an anti-influenza antiviral like Tamiflu. This is particularly true for people who fall into the risk categories where complications are common. So if you're an elderly person or you have an underlying disease, you should not wait to get anti-flu medication. Well, influenza is a very unusual virus in that it tends to drift from year to year, and sometimes when you get a pandemic, it's what we call a shift. There's a major change. This is so different from other important viruses like measles. The measles I got as a child is the same measles that's in the vaccine that we vaccinated my children with. So you don't have to worry about that change. So what we're fighting against is trying to get a vaccine that would induce a response against that part of the virus that doesn't change from season to season or with a pandemic. We refer to that as a universal flu vaccine, and only relatively recently have we been able to get an insight to understand what part of that virus actually doesn't change very much from year to year, and now how can we induce with a vaccine a response that would be dominant against that particular part of the virus. Because the vaccines we make now, when they protect you, they make a response that's a good response, but it happens to be against that part of the virus that tends to drift because of mutations from year to year.